WashU and also France and some other locations. And it's some hope, Blair, in the treatment of the deadliest form of lung cancer. We've got Dr. Nima Mosama Prasad. I'm sorry, doctor, I tried my best. He's with Washington University, pathologist at Siteman Cancer Center. Say your last name for me.
Osama Parast.
There you go, that's perfect. And this study is fascinating because when you have small cell lung cancer, you have that diagnosis. It's a death sentence, basically.
Yeah, it's the deadliest form of lung cancer. And the tumor initially responds to chemotherapy, but usually within months, it comes rip-roaring back and there aren't too many options.
So an old drug was used and introduced, and some surprising results were found. They were using mice. Explain this.
Right, so what we did in this study was to combine this older drug with a newer experimental drug and showed that the combination works significantly better than either one of them alone.
The lungs began to clear of the tumors.
That's right. And so in certain experiments, we showed that the tumor actually shrank, and in others, the tumor actually stayed the same size, whereas the single drug, it continued to grow.
For how long did the lungs stay that way?
So this is in mice, so it's a little bit difficult to extrapolate to humans, but it was for several months.
So the next step is to try this on humans.
That's right. We're hoping to do an international initial trial because it's always helpful to have larger groups of patients. And another thing that we're trying to do is to combine these two drugs with a third drug that may hopefully make the combination even better.
Oh, that would be interesting. Now, this older drug that was used, do you see some difficulty in getting doctors in the to say, yeah, we're going to use this old drug again after they haven't used it since what, the 1980s?
That's right. So this drug is called Cytoxan. It is used for certain other tumors still to this day. It hasn't been used for small cell lung cancer, so we have actually had some resistance from clinicians. But one of the things that we can potentially do is to actually reduce the dose in this combination to reduce some of the side effects that the drug would have on its own.
All right, if somebody's watching and let's say they just had that diagnosis of small cell lung cancer, they say, I want to get in on this study. When do you think this would begin?
So we hope in the next year we would have an early phase clinical trial. There are, of course, a number of other clinical trials that are happening at Siteman Cancer Center. And if anyone is interested in seeing what work is being done, they can go to siteman.wustl.edu to find out more about it.
I'll tell you what we're going to do. We'll put that link on our website at fox2now.com, and you can look for the information there. So thank you so much for joining us, Doctor. Appreciate it.
Thank you.
And a hopeful sign on the horizon.